Cool. Okay, let's get started. Hi, everyone. Welcome. I'm Ben. I'm the Crisis Line Program Director. I'm a family member who have supported loved ones through mental health and suicidal crisis. I'm also a social worker. I served as a case manager intern through County Behavioral Health at the Oakland Community Support Center. So I've been able to utilize some of the services for my clients that we're going to talk about today. And I just want to acknowledge that it takes a tremendous amount of courage to reach out and ask for help for yourself and for others, and to ask for help for your loved ones. And when you do, you know, it's perfectly natural to wonder, like, when I ask for help, is the helper going to understand what I'm going through? Are they going to judge me, right? Will I get the help that I need? Will I be hurt or even killed by asking for help? One thing I could say is that our team of panelists here today are like the real deal. They're super amazing folks, and I'm super excited to share with you all. I gotta be real. This morning I was feeling a little depressed. You know, looking out the window, I literally could not see the sun, and I was feeling anxious, sad, angry, right? And how many people in the room are feeling that, a little bit of that today? We live in a messed up world, plain and simple. And so if you're feeling a little depressed, a little anxious, know that it's not your fault, and it's not your fault, and you're not alone. I had to fight the urge to just stay in bed and pull the covers over my head and call in sick to work. But what got me out of bed was thinking that at 12 o'clock, I will be in a room full of amazing and supportive people who are dedicated to healing our community. And as a community, we are hurt and we are angry, especially our Black friends, neighbors, colleagues, and loved ones. You know, we saw our own Stephen Tyler dying at the hands of the police. And just we want to acknowledge and validate that you have a right to be angry. And as a community, we need more resources to support our loved ones, to support ourselves. I want to show a slide of our crisis continuum. The way we think about crisis is that it happens in stages, and there are different resources related to which part of the crisis continuum you or your loved one might be at. Today, we're really going to focus on when things are breaking down, when the crises are at its worst, when we feel our worst, at the toughest part of the crisis. The providers here represent programs that are alternatives to utilizing law enforcement for mental health crisis. And we at CSS have had the pleasure and honor to be colleagues and friends with with our program leaders here. And it was important for us to extend that connection to our community, so that you know who's there to help, who to call to help. Our agenda for today, it's going to be mostly lecture style since there's so many programs to talk about. I see Christina's here. Yay, Christina, nice to see you. Let me unmute, or let me ask you to unmute, because Christina's first on our list. And I want to share a story. Just like last week, I was feeling down, and just like thinking about, you know, what's going on in the world and my family. And I get a notification on my phone, and I look down. It's a funny GIF that Christina sent to me out of the blue, and it totally changed my day, turned my day around. And like, I really appreciate that kind of support from Christina. And it's the kind of support that I'd like to see for everyone in our community, right? That we're looking out for each other, that we have each other's backs. And it was a friendly reminder that I'm not alone in this world, in this struggle, in supporting the community. So with that, I would like to hand it over to Christina if you're up and ready.
Okay, I just wanted to say thank you for the acknowledgement. I really appreciate that. I think that it's important for us as leaders to role model what we want. So we have to role model what we give is what we will get back. And so we have to look after each other as leaders, because our support kind of narrows for us because of our roles. And so it's important that we are able to look after each other in our group. And so thank you for that. And I wanted to start off by saying good morning, everyone. It looks kind of interesting outside, right? It's kind of red. Maybe that's a reminder to remind us to love ourselves, right? And love on everyone. Color red for love. And so today I'll be talking about Sally's Place. And I'll have to leave a little space and room for questions for anyone to have questions. Can everyone hear me well?
Yeah, I can hear you.
All right, great. So with just a show of thumbs, how many people have heard of Sally's Place Pure Respite Home? Okay, great. All right, great. So La Familia Counseling has a respite home called Sally's Place Pure Respite. Sally's Place Pure Respite. What is pure respite? That's what people ask. A lot of times when people are talking about respite, they think about dying. This is not. This is a place where you can heal healthy with your own power without your power being snatched from you. So what is pure respite? Pure Respite is a voluntary short-term program that provides non-clinical crisis support to help people find new understanding and ways to move forward with their recovery. It operates 24 hours per day in a home-like environment. Again, I'm Christina Murphy, and I'm one of the program supervisors there, and also a peer support specialist outside of Sally's Place in there as well. If you like, you can move on to the next slide. So the next slide has, for more information or how to get a referral, here's our email, our contact number, Sally's Place at lafamiliacounseling.org, 510-963-9849. If you have trouble contacting that number, which you shouldn't have because we answer 24 hours, you can call my phone, which is open 24 hours for sure, next to my pillow, 510-935-9626. During the COVID-19 shelter-in-place, Sally's Place will be providing crisis peer respite for up to 14 days in addition to peer support services 24 hours a day. At Sally's Place, the people that discharge, we are still contacting them on the weekly or daily basis. It depends on what they request. So all the peer support specialists reach out and call, go through our files and call the people that have discharged to offer peer support or referrals over the phone. People that are eligible are 18 and older, of age and older, are experiencing a mental health concern or distress, resides in Alameda County, voluntarily agrees to engage in services, agree and complies with COVID-19 county public health guidelines. When we say voluntarily agree to engage in services, we mean like we don't force you to go to a group if you don't like. We just leave the open space for you, and we encourage you to come because we would like your presence. And as far as if they have their own appointments or things set up, we don't get in the way of that. We try to see how we can help foster that, or if they need transportation, we offer the transportation or the guest support funds where they can get on public transportation on their own. And we also, upon them leaving, we give them a PPE to-go packet, which has 2 gloves, 2 masks, and hand sanitizer in case they see somebody else in the community that might need a mask and gloves. Because it's all about teach one, each one, right? And also, people would have to, it says resides in Alameda County. What it means is that you would have to have an address in Alameda County to return back to after the 14 days. We ask you to commit to that. And we also have a sign-off sheet on our welcoming intake packet that you are agreeing to go back to this address after 14 days. Now, with that being said, there is a little area for people that the county have approved for people that are living in their vehicle. So if you're living in your vehicle and you have an address, right, or where you're going, we are able to bring you in as well. You do meet the criteria as well. And in that, we kind of discuss like around what are your goals, around what your permanent housing will look like, you know? And we have those kind of conversations with the guests. We don't do the housing part of it. We don't do the housing part, but we do the housing navigation where we show them online on how to apply, because a lot of housing you have to apply online now, and you will receive the feedback through your email. So we're showing people how to get on email. And so that's how we are connecting with that. And then as far as self-help groups, we connect the guests to self-help groups. So a lot of people don't want to go to AA. They might need smart recovery. They might need um, Debit Anonymous. That's what I needed when I first started. And so the self-help groups are very helpful. So we refer to that. The peer advocate is Anthony Jasper. He works with the guests on a 4-stage flow chart where he follows each phase for them for the whole 14 days. The first couple of days, they do welcoming. Second couple of days, they kind of reflect on what they would like to do. The next couple of days, they talk about what their plans are for leaving. And the last couple of days, they're on prepping to go home. Overall,
uh-oh, no, we lost our audio, Christina. No, we can't hear you, Christina. Try again. Oh, you heard something.
I don't know what happened.
Okay, it works now. We're good.
So where was I at? What was the last thing y'all heard?
You were talking about the self-help groups.
Oh, okay. So the self-help groups have been really helpful with connecting people to the options. A lot of people are forced or told to go to these groups, and instead we don't do that. We talk about what groups has helped us, and we have a whole list of all the groups that exist on the wall, and we just take the guests over to choose their own groups, and we help them navigate to find a group in their area. We also do outside activities, but at this time, with all the smoke and the ashes, we've been trying to do things indoors. So we've been doing tie-dye, painting, other wellness activities, watching funny movies, watching comedy, cooking as a group. And so as you see on the next slide, what to expect. Receive support from compassionate peer staff. All of our staff have lived experiences, and we are very diverse on our team. In age, race, all the groups you could think of, we're very diverse. Linkage to other resources and services, compassionate listening, and emotional support. We also use a bed bug burner. So when the guests come in, when they first come in, we bed bug burn their items that they bring in to ensure that we don't bring in anything, and to ensure that if they have any exposure to COVID-19 on their clothes, it will die because of the heat. And so we, according to the research, right? And then, so that's what we do. And we also don't charge. They can stay up to 14 days. We do not do extensions. We do readmits. So like if a person is still working with the peer advocate and the case manager, we're all working together and they need a little bit more time to prep, we will readmit them to come in for another 14 days. A lot of people don't stay for the additional 14. They only stay for like 3 or 2 more days because they only need that for their case manager. We collaborate with the family and the case manager if that's what the guests would like. Basically, Sally's Place is about making sure that the guests feel empowered and that they're empowered in their own treatment and they create their own treatment plan and that they're their own experts. And so that's how it should be done. And so that's how people heal, when they're empowered, not when people fish for them, but when we teach them how to fish. And so I want to thank you for this presentation, and I want to open up the floor for questions.
I'm wondering if it's okay if we hold off on questions till the very end.
Okay.
Yeah. And if people are thinking of questions, go ahead and type in the chat, and then I'll monitor the chat.
And again, I want to thank everybody. Thank you for attending this presentation. And remember, we are the working ants, and nothing holds back an ant when they work together. They get through all.
Oh, the audio cut out for the last 30 seconds.
Thank you. We're the working ants. Keep working, everybody.
Thank you for starting us off with so much great energy. Sally's Place is located in Hayward. All righty. Oh, and we'll attach some flyers with all this information on the event website. I want to pass it on to Celeste and Rafi. Do you want to take it away?
We'll take it away. So my name is Rafael, and a long time ago in the 80s, 1988 to May 88, starting at 87, I was working at Highland Hospital I was an administrator in the Department of Psychiatry. And one of the things that we had a difficulty with is police bringing in people on 5150 to the psychiatric emergency room. They were evaluated, seen, put out the door, only to sometimes be returned, sometimes the same day, if not the next day. So I had well, it wasn't the first one, but there were other programs, mainly Berkeley Mental Health had a mobile crisis team. So I decided to see if we could accomplish something similar in Alameda County. So I requested the Oakland police chief at the time to let me ride along with police officers throughout the city on different times of the day, week, so that I could literally, through the windshield of a police car, see what they saw. And, you know, of course, back in those days, there was no cell phones, no means of communication, but I started, instead of just observing, I would tell an officer who was ready to write a 5150 on someone, listen, you know, had a whole bunch of quarters to use the few telephone booths that were available. I can make a call, we can get this person to see a doctor or his counselor the next day and so forth. So it's a longer story, but I'll make it brief given the time constraints. So the program was recognized. I wrote a proposal to the county, and we started out with a van and some police scanners so we could monitor the police calls, and we will just head out when we got a call that we thought we could help out. We introduce ourselves to the officers and try to come up to alternatives for them to write a 5150 and send them to the emergency room. The program was well taken by the police and by the county. They gave me some staffing and some support in a vehicle. And ever since then, it has grown and it has expanded a great deal. And we'll talk about a little bit about that.
Rafael,
several teams in operation, and but my partner Celeste will tell us how to get a hold of us and how we initiate calls to us.
Rafael, do you mind changing your camera angle so we can see your whole face? Right now, we only see your mouth and your.
I can't see anything. How is that?
Angle it a little bit higher. Now we can see your nose. There we go. Now we can see your whole face. It looks like you're leaning way back.
Is that better?
A little too far. Get closer. Okay, that's good.
Okay. All right. I don't see a picture of myself on the screen, so I can't tell. Thank you.
You look great.
As Rafa says, we are ever evolving and ever expanding. So currently we have several different models of mobile crisis teams. As you can see on the screen that's shared, it started out with 2 clinicians, and we still have that model operating in Oakland as well as in South County. So in Oakland, we respond to there's a model for 2 clinicians to respond to calls. And they carry police radios, so they respond to a majority of police calls, 911 calls. We also do receive calls to our clinic, and an on-duty clinician, which Rafa will talk about, collecting information and then sending our mobile team out. We also have another model where in East Oakland with a clinician paired with an officer. So a clinician is riding in a police vehicle with an officer responding to those 911 calls, as well as some calls from the office. And in March of 2019, these services have primarily only been available in Oakland and Alameda and Piedmont. They have expanded to all county outside of Berkeley Mental Health, as they provide for Berkeley and Albany. And so we have a 2 clinician model that's based out of Hayward, but responds to San Leandro, Hayward, Fremont, Union City, the Valley, the majority of those calls are coming through community members, case managers, and family members who contact us requesting an assessment, whether it be they know that the person might meet criteria and needs to be placed on a 5150 hold, or perhaps there's question marks, or perhaps it's, the symptoms, individual symptoms they're declining and they want to get reconnected to services. There is another team, a CAT team, that I'll talk about in a minute, but maybe Rafa, you can talk about the OD.
Okay, so our headquarters is in Hayward, and every day, Monday through Friday, we have an OD on duty. I happen to be the OD today. I will take calls from the community, from police, from other agencies. They're requesting, they describe a problem that they would like the mobile crisis team to intervene. I assess the situation and decide which team to send, of course, depending on what city it is and what the situation is going on. And out of that assessment and triaging, I will call either the South County team, the North County team, the Met team, or I will suggest to the callers, if it's something that is beyond the mobile crisis team's capacity, that they need to call law enforcement. If somebody is locked up with trying to hurt themselves or somebody else with a weapon, there is not that's not something that we do. It's important to know that we, as the mobile crisis clinicians, we're civilians. We cannot touch people. We cannot break doors. We cannot put our hands on people. Only law enforcement can do that. So the OD screens and directs the calls to, where the best possible outcome can occur. It is important sometimes when I tell the people that I have today, it's very hard to tell people you need to call the police, because most people don't want the police to be involved, and neither do we, but sometimes we do not have a choice. There's only the ones that answer sometimes at certain times of the day because we're not available. And in Oakland, I tell people that they can request a CIT train officer. That's a crisis interventions training officer. The Oakland Police is training all their officers and some of the officers from other jurisdictions in crisis intervention techniques, so they can better understand people that are experiencing psychiatric distress, so they can approach the situation better.
Rafael, will you describe the CAT team and what that is?
Yes, the CAT team is it's a program that just started in Oakland. It's expanding to other cities. It consists of a EMT, emergency services technician, and a clinician, a clinical social worker, and they respond to calls to provide transportation to, say, Amber House, Woodrow Place, John George, with people that are not combative and that are willing to go, that are willing to be transported. They can write 5150s if they need to, but they provide transportation to individuals who are experiencing stressful situations, and in addition to receiving crisis intervention, they can provide transportation. And they're to various cities, and their hours are also longer than ours. They work. I think the idea is that they're going to be 24/7 eventually.
Can you confirm that the CAT team is now available 7 days a week, 7 a.m. to 11 p.m.?
The CAT team is not, at this point in time, as far the latest information I have, they're not available that extended time. I believe that maybe in next month or so, they're hoping to expand to the weekends. Currently, their hours are Monday through Friday. And I think their services are 7 to 5 at this time.
And it's important.
Pretty soon they will be expanding until 11.
And to get a hold of them, you have to call 911 and ask for them. Yeah, because they operate on a the 911 dispatch system.
I think the key difference for everyone to recognize, if you're not sure what kind of intervention or what kind of service team that you want, but your client is experiencing a client, is you can always call our office and the on-duty clinician can make the assessment to refer to the appropriate team. The key difference, if you're interested in knowing in terms of what our mobile teams are able to do versus the CAT team, the intention of the CAT team is really to, well, let me actually back up. All of the teams, the intention is really to try and mitigate a psychiatric hold as much as possible, and try and come up with other safety plans or other trying to mitigate the safety by instituting other things like transporting individuals to one of our crisis residential crisis stabilization areas, or maybe they need substance abuse treatment. So our clinicians can make the assessment about what and where an individual needs to go. The CAT team can place individuals on a psychiatric hold. They can complete the 5150 application if need be, but they have a specific vehicle that's tasked in being able to transport individuals in a variety of locations. The other factor to remember about the CAT team is they actually spend probably more time trying to come up with that safety plan, whereas our mobile teams are quicker assessments and quicker turnarounds. But again, if anybody is confused about what team to call, the on-duty clinician can advise a person calling.
Great. Thank you, Celeste and Rafi. We're going to post these slides available for everyone so you have this information. We're going to have to move on to Daniela. Is that okay? Okay, here we go.
Thank you so much. And this was super useful information. And I'm with Christina on us being working ants. It's been work these days, very, very hectic. So I am here for the Anti-Police Terror Project, and just for a context, what APTP is a grassroots organization that started in Oakland in 2014. That is a multi-generational and multiracial coalition of people who are building a replicable and sustainable model for eradicating police terror in communities of color. And so, APTP started out of this sense of pain over multiple police murders over the Bay Area as well as around the country, where oftentimes there would be like a big surge of protests for a while, and then like people would get tired and burnt out, and then things would go kind of back to the same, right? And so APTP wanted to get proactive and start working in a very organized and sustained manner to eradicate this traumatic and oppressive set of conditions, right? And so APTP offers a holistic support. So we work on policy, we work on grassroots action, and we also provide direct services. And one of our new projects in terms of providing direct services is MH First. So next slide, please. So MH First is a crisis response service that currently is all volunteer run and operated, launched in January in Sacramento first, started by one of APTP's co-founder, a registered psychiatric nurse, Asanteva Boykin. I wish she could be here with us because she really is the brain, behind all of this. And so she started it with her team in Sacramento, and we just now launched in Oakland. Currently, we operate as a hotline only because of COVID concerns. However, we are soon planning to enter into a phase 2 of actually being able to dispatch team. team of responders. We do operate after hours. So currently our time is Friday, 8 p.m. to 8 a.m. on Saturday, and Saturday, 8 p.m. to 8 a.m. on Sunday. And our philosophy is just to work really from a transformative justice and disability justice perspective and eliminate as much as possible the engagement of law enforcement, right? And so we have our own number that is open. We do not work with 911, and we just try to kind of gather as much as community resources as possible to be able to support the people who call us. I did want to say, I know one of your questions, Ben, was about like what motivates us in this work, right? And there have been so many like really horrific cases in the Bay Area of like law enforcement killing people in the midst of mental health crises. And one of the first incidents that we responded to back in like either end of 2014 or beginning of 2015 was an unnamed victim who was a person who was in the midst of like potentially like taking their life, right? And the police was called by a roommate, and the person ended up dead instead of receiving help. And we got to the house and the roommate was just completely traumatized. He wouldn't even talk to us. We never found out the name of the person, but that was just like a really stark, very real kind of experience, right? Like of thinking, well, there has to be something else. Like we have to be able to do something else. And we can't rely on these systems where law enforcement is present, unfortunately, right? Like that's the tragic kind of reality of today. So I know another one of your questions was like, how do we ensure like social justice values? And APTP is very much committed to following Black leadership. So we are all accountable, to the Black Leadership Committee of APTP. And there is a very strong sense of working in ways that are holistic, that work on change of policy as well as on direct support. And we take feedback from families that are impacted by these police murders. And so, we work closely with Stephen Taylor's family. We work closely with Maria Moore, who is the sister of Kayla Moore, Kayla was killed in Berkeley by Berkeley police. We work with Errol Chang's family. Mr. Chang was murdered in 2014 in Pacifica by Daly City SWAT team. And we also work with Tawn Hall, who is the mother of Miles Hall, who was killed in Walnut Creek last year. So I think, we have a wonderful, wonderful, diverse group of volunteers. In our phase 1, we have about 30 people who are available, to take calls, to be scheduled for shifts, and to eventually dispatch as well. Majority of us are either mental health professionals or people with extensive peer counseling experience, and many of us have lived experience. So we've been really aiming to like reach that intersection of lived experience and training, right? And we continue to expand. We're getting a lot of inquiries about expansion to other cities and other states. So it's definitely a very hectic time. And if we have time, I'll be happy to take any questions later.
Thank you so much, Daniela. So lovely to have you part of the panel.
Thank you so much. And it's so emotional for me actually to be here after the launch and to be included in this, because with APTP, we're used to be always in the margins, right? And so to be brought in and invited to contribute and to connect with you all is really helpful, because we want to build relationships with you all,
Yeah, we all have the same goals of wanting to build a safer, more connected community. And yeah, let's keep the conversation going. Okay, I'll hand the mic over to Allie.
Hi, everyone. My name is Allie Ballard. I am the Associate Director of Crisis Residential Programs, a couple of which have been mentioned already, Amber House and Woodrow Place. Those are our two in Alameda County. And I can speak a little bit to some of the great services that we've heard from already, actually link people to our crisis residential placements. And we are basically a soft landing spot, ideally looking to avoid hospitalizations, or can often be a place for after hospitalizations as well. And my background is that I'm a clinical social worker. So first I'll start with Amber House. The address of Amber House is important because we are open for walk-ins 24/7, 365. If someone is having a mental health emergency in a non-violent, non-restraint level capacity, they can walk in, a family member can bring them in, mobile crisis teams can drop them off, OPD can drop them off. Really anyone has the capacity to refer. If you're a mental health provider, we ask that you simply give us a call first. But if you don't have to, there's no referral needed. And if we go to the next slide, please, I will explain some of the differences because it's actually an integrated program and I can explain some of the services that we provide. So our downstairs unit is what we call our crisis stabilization unit, or a CSU. I think when a lot of people think of a CSU, they think of a hospital, and a lot of them are locked as well. We are unlocked. As you saw from the photo before, it is a house at 31st and Telegraph. It's a really big, nice remodeled house that here at Bay Area Community Services, we've owned it for about 50 years. We remodeled it in the last couple years to build Amber House. And the downstairs is our walk-in unit. We provide 24-hour assessment and triage for really acute levels of mental health crises, and the goal being to reduce the amount of 5150 holds and really provide community-based crisis support and de-escalation. And I think that, you know, being a service provider, I have seen so frequently, as Raphael mentioned as well, more often than not, someone who gets put on a 5150 hold or assessed for one at a hospital may then just get discharged and sent back. And then maybe a day later, the exact same thing happens. We're trying to reduce the ping-ponging between hospitals and police and emergency services and really just have a holistic community-based place for people to rest and get the support that they need when they're in a mental health crisis, because more often than not, those people can get safety and security in an unlocked facility like ours that simply has mental health professionals, including a nurse and a clinician and peer counselors on site to talk them through and really assess their level of risk. So upstairs, which I'll talk a little bit more about as well, is a crisis residential treatment unit, and that is fairly comparable to a treatment model like Sally's Place. In that it is 14 days. The difference being it's a really clinical program. So it is, if someone has a mental health diagnosis and needs support for psychiatry, clinical support, groups, things like that, we provide up to 2 weeks of residential treatment with intensive both therapy and case management. So next slide, please.
Allie, can you confirm that Amber House is adults only?
It is. So all of the programs that I'm going to be speaking of are for 18 and up. So this is a photo of what our downstairs triage unit looks like. This is the one that you can walk into at any given point. If your brother is having a crisis, if you have a friend of a friend who you think might need a resource, they can walk in at 2 a.m. The services that we provide downstairs is an outpatient medical assessment. Currently, during COVID times, this includes a COVID screening, so a temperature screen to make sure you're safe to come in, a symptom check, things like that. A full mental health evaluation to the capacity that someone's able to participate in that. We try to make it as brief as someone is able to do. Any crisis de-escalation needed. We have a lot of people who come in really at the height of when their crisis is. And so we also provide case management really from the first hour. You know, the downstairs is only up to 24 hours that someone can stay there. And so case management and discharge planning really needs to start from minute one. Is what is going to be the plan? Is it that we really need to calm and de-escalate the person to even engage in case management? Is it that we need to locate their family because the family said they can come back? They just need to de-escalate and be safe first. Do they need potential access to our upstairs 2-week program, in which case we can facilitate a referral if that's appropriate, things like that. We try to meet all basic needs. Many of our clients are homeless, so that is not a necessity for referral criteria. We meet all basic needs, giving someone food, a shower, a change of clothes. You see that everyone gets assigned a chair or a bed, which is, it reclines all the way and most people can sleep the night there. And we offer transport to a discharge location if appropriate and if someone is safe enough to do that as well. So upstairs, Amber CRT, which is our upstairs 2-week program, that's at slightly longer term crisis stabilization service. And again, 2 weeks is not a whole long time, but it's longer term in terms of a crisis. We provide, everyone gets assigned a clinician for their mental health. So that provides individual therapy, family therapy, if anyone is willing and able to participate, 4 group therapy sessions per day. Case management and resource linkage if someone needs to be linked to benefits or to substance use counseling or to outpatient providers. We provide psychiatry services. We have a psychiatrist who meets directly with clients and can provide up to a 30-day prescription for psychotropic medication. 24-hour counseling support. If someone wakes up at 3 a.m. and has a PTSD flashback, there are 2 awake overnight counselors to be able to de-escalate and provide support at all times. And full-time nursing support as well for any outpatient level medical needs. So anything that you could do in a doctor's office, but not necessarily a hospital, because we are a house outpatient type environment. So here I put what our schedule looks like. It's a pretty structured program. We have 3 meals a day. When clients have the capacity to help us cook, and again, per COVID in a safe manner, we love to teach activities of daily living like cooking, make sure that people know how to do hygiene. More often than not, a mental health symptom may incapacitate someone to be able to do things like cooking or budgeting to shop for food, things like that. We try to really incorporate clients into that process. We do groups like mindfulness, wellness walks, knowing what my symptoms are, exploring values, medication education. We support clients in taking their own medication in a self-administration way. We are fully hands-off in the capacity of we don't do any restraints, whether it is manual, by a person, by injection, anything like that. And so everything is voluntary that we do. For both programs, if a client doesn't want to be there, they can leave. We of course try to counsel them to stay if if it's not safe, then we might have to explore a 5150 route. But more often than not, it's really how can we engage you to stay and want to engage in your treatment here. So the goal of a CRT stay, ideally it's diversion away from needing a 5150 hold. You know, we've seen so many times a 5150 is really a short-term crisis de-escalation of there are no other options to keep someone safe. So they have to be in a locked environment with so many of their rights taken away. More often than not, in what we see in mental health crises that get pretty high level, is that we don't actually have to take all those rights away, and we don't need a locked involuntary environment to be able to mitigate safety concerns. So we really try to provide a really thorough assessment of psychiatric needs. So if someone has gotten 5150 10 times in the last month, that's telling me and our team, this person needs a higher level of care than whatever their daily routine is, because whatever their routine is clearly not working if they're accessing emergency services so much. Let's take 2 weeks and really assess what keeps them safe, what support do they respond really well to, what are they saying their needs are, what is, you know, sometimes providers can really drive the treatment. We ask that the clients really drive their own treatment so that it's not us impacting their goals, it's them telling us what their goals are and us supporting them and empowering them to achieve them. We can evaluate changes in medications because, you know, that, as we all know, with anyone who's ever been on psychotropic meds, the first couple of weeks of that can be really wild in terms of side effects, in terms of, I can't tell if this is working. Is it supposed to make me feel worse before it makes me feel better? Sometimes people don't feel safe enough to even try a new medication because they don't have a safe place to land if it doesn't work. This is 24/7 evaluation where you also have other professionals evaluating you while you've made this change to say, hey, I've kind of noticed you haven't been hungry for the last couple days. Is that true? So someone could be like, oh yeah, I think since I started taking my meds, my stomach's hurt a little bit. And then we can meet with a psychiatrist and see what's going on. We try to engage natural supports and other providers as much as possible. We are a short-term 2-week program. Our goal is to help someone connect, either to help their family or friends or loved ones or caregivers understand what some next steps are going to be, or to link them with long-term care providers, whether it's a full-service partnership or a community mental health or outpatient service team, to really get an understanding of, hey, here's what we have observed while they've been here. Here's, I think, the long-term work that's needed. Let's set you up for success in getting that started. And then accessing new resources, things like housing, outpatient services, medical services, and benefits. Those can take, as we all know, many months, if not years, to access, but we can at least, while the person is there and being supported, get all the applications in, explain to them what the differences are between the 10 types of SSI benefits that there are. They're so confusing, even for our staff, that it's nice to just really be able to, if someone wants to just throw the computer screen away because their application is taking too long, for us to really sit down, help them do some deep breathing, and help them finish while they're with us.
2 more minutes, Allie.
So Woodrow Place, which is our Hayward CRT, is the same model as Amber, the upstairs. Woodrow has been in our community for 25 years, whereas Amber has only been in a year. We don't have the CSU triage unit in Woodrow. You do need a referral, but I just like showing the photos because it's a nice, very therapeutic outdoor space. And that's the Hayward version of our CRT. The challenges that we really see with this model is between the 3 CRTs in Alameda County, there's only around 45 beds total at any given time. And I think we all know there's a couple blocks of Oakland alone where you can find 45 people who need this service, and that's not even the rest of Alameda County. Also, given the level of acuity and high risk and need for many of the people who come to need our services, it's really hard to only have them for 2 weeks. So more often than not, we really are asking for extensions, but that means that we can't take a new person on in their crisis. And then also the long-term resources that we're trying to link someone to often take a lot longer than 2 weeks to get. So as it relates to social justice and equity, when we talk about law enforcement and police brutality and the Anti-Terror Police Project, we really see services like CRTs, Amber House, and Woodrow as one of the solutions. You don't need any police in order to engage us. However, it's also an alternative for police, instead of doing a 5150 or even engaging in a mental health crisis, to simply drop them off at one of our houses and let us deal with it. We're hands off. We are totally non-restrictive and no restraints. Amber House is the first CRT designated to write their own 5150s, which entirely remove law enforcement from that process. So we basically have mental health clinicians who can write it and then call the ambulance, and so we don't need police or anyone on site. We have a really diverse staff at VAX. 80% of our employees identify as people of color, as well as 62% of our managers. And we incorporate the discussion and protocols of racial and social justice in everything that we do, in the vendors that we use, in documentations, how we write our notes on this, in the types of clients who we try to have access to. And most importantly, I think Amber CSU is a great example of anyone can just walk in, and we're in a historically marginalized area that's really deeply impacted by homelessness, substance use, and poverty. We try to lower our barriers to service as much as possible.
Thank you so much, Allie. It's so lovely to share such great information to everyone.
Thanks so much for having me.
Yay. Jeff, you're on. And here's Allie's contact information.
Sounds great. Thank you. All right. So I'll keep mine nice and brief. So I'm Jeff Buell. I'm currently the Berkeley Mental Health Crisis Services Program Supervisor. The programs I oversee include our mobile crisis team, our transitional outreach team, our crisis assessment and triage team, and our homeless outreach team. I came up through college with all sorts of other transition age youth and had a different idea of what my pathway would be. I was a science nerd. Math and engineering is what I started off doing. And my experience, with a whole bunch of other young adults who were trying to find out who they were, and having friends who had mental health crises, and I even had a trio of friends who was always together. And we as young people didn't recognize a lot of the warning signs and other concerns that we as professionals, we as people with lived experience have seen. One of our friends, he, was very depressed. And, we recognized some things about that, and we were, trying to be supportive in the ways that we knew. One day he went to the Golden Gate Bridge and he jumped off. It was more than he was equipped to deal with, and it was more than we were able to support. After experiences like that, it helped me shift my own focus. I moved to psychology and biology. I came back to Cal, and I got an MSW instead of doing engineering. I've worked in crisis services and outreach services and transition age youth services, adult services, older adult services, and here I am now back in crisis. It feels like the right place for me, just knowing what the need is and what are the different things that we have to offer. So again, Ben, thank you for bringing us together so we can share a little bit about our programs. The Berkeley Mobile Crisis Team is the oldest in the country. It's 41 years old this year, so happy birthday to Berkeley Mobile Crisis. And it's been a great collaboration to watch over the years. It seems like a lot of different programs have learned a lot from each other. And Berkeley Mental Health is moving in a process now to continue learning from the rest of the continuum as well, to make some of our own shifts. Right now, we're a model that goes with a clinician and a police radio, and we are primarily dispatched by the Berkeley Police Department. It's possible for folks in the community to reach mobile crisis directly by leaving a voicemail, and that's not what the community has been asking for a long time. They've been asking for other ways that we can access and provide crisis services in ways that can be a little bit more community friendly and what folks are looking at. So in the chat, I'm dropping off our contact information and our hours for our crisis teams. And again, and I can send this to you as well, so you can add this. But our mobile crisis team primarily is for folks who are in crisis now. They're not necessarily looking for an entry into mental health services, but they could get one. Our mobile crisis team with licensed clinicians is able to write 5150s in the field, and they're able to do, consultation over the phone. We can have a discussion about referrals and other things, but they're really an in-the-moment kind of service. We've created a transitional outreach team, which you'll see there as well. And that team is designed to follow up on folks who have had contact with the mobile crisis team and they've been through a crisis. And they need something a little bit more, or they need access to a longer term set of services or treatment or care. And so that team makes sure to check in with folks and say, hey, I know you had a hard time the other night, and what can we do to help connect you up to services that might be helpful for you in the future? That could be providing you support now. So if you start approaching a crisis again, you have some other skills and supports. We also have our own CAT team, Crisis Assessment and Triage. And that team historically has been our version of Access for the city of Berkeley. We have added a crisis line to it. And the state who had granted us the money for it did cut down the grant, so our hours were cut. But during COVID, we decided to just increase our hours. They are now 10 a.m. to 5 p.m. for that crisis line, that daytime crisis line. Gives people an opportunity in the community if they want to check in with a clinician live instead of talking to a dispatcher or a police dispatcher. It gives them that opportunity to do so, and then determine what other next steps that they need to take. I do see that there's a question in the chat about what's our catchment area. The Berkeley Mobile Crisis Team continues to serve Berkeley and Albany for now. the city of Berkeley is entering into a contract with Alameda County, and it looks like Alameda County is having us define our services specifically for the city of Berkeley. So as we're transitioning right now, we're not taking new long-term clients from Albany, but again, mobile crisis services are still provided for both cities until at least spring of next year. And so our CAT team as well, you know, they can provide information and referral assistance. They have, you know, the crisis capability over the phone. And again, that's another service that doesn't involve police. Only the mobile crisis team does involve police out of all of our spectrum of crisis services. They're able to do assessments in the field if necessary. We do have walk-in hours for folks who don't have access to telephones or telehealth. And I put our hours in there. They're Monday through Thursday, 10 to 1 for our walk-in services, currently at 1521 University. The mobile crisis team and transitional outreach team will work with all ages. Our CAT team is for adult services. We have family, youth, and children's services that don't involve crisis, and that's a different access point for folks who are under 18 or who are TAY. And then we also have our homeless outreach team, or at least the last vestiges of it. The city is in process of transitioning our homeless outreach team into a homeless FSP, and the outreach service is going to get moved to the city manager's office at some point in the next month or two. But in the meantime, we're still outreaching to folks in the community who are unhoused on the street. We will serve whatever ages of folks who are out there on the street. We're officially supposed to be for adults, but sometimes we see teenagers or transition age youth out there on the street as well. All right, I know we're short on time, so Ben, go for it.
That was incredible, Jeff. Thank you so much. And I really hear you too when you say how you've incorporated the feedback from the community, right? And you're working to expand and make the services more tailored to what the community is asking for.
I would have added also, we are in process of a crisis system evaluation to, you know, take a look and see what else is being done in the community, in other locations, see what services are needed here, and then get some feedback to be able to make some further transformation. So we are still in flux and learning as we go.
We support you and your whole team. Everyone in this panel believes that there's no one size fits all, right? So our goal as a system is to create various different kinds of options so that if someone's in crisis, they have choice. They have ability to choose where they want to get support, what's worked for them in the past. The other shift in our crisis service delivery is, you know, when you're someone who's going through crisis, you want to go somewhere where there's respite, where there's care. So you want to think of like a hotel, a resort, right? Or a home-like environment where you can rest and relax, get back on your feet. And I really appreciate that Amber House and Sally's Place has really taken that, made that a possibility. These services were not quite available to our community just 2-3 years ago. And it's really thrilling to see this expansion. I want to give the panelists a final opportunity to give any last words. Go for it.
I would like to just say again, thank you, everyone. And Amber House, thank y'all so much for all y'all referrals y'all send over to Sally's Place. We appreciate being able to work together as a team. And thank you so much for mentioning the fact that there's not a cookie cut for our world. We need to have infinity options. And so by having a place like Amber House is great for people. Like when I was in crisis, I needed that structure. I needed a clinician there at the moment to help me adjust my medication. At Sally's Place, we have it to where the guests do their own medication administered, the guests do their own COVID screening, the guests do their own, and we are there to support if they need it. And sometimes that's what people need. People don't need someone telling them, hey, adjust it this amount or this amount. Some people need to just be able to flush out and process what they're going through in the moment, you know? And after that, they're able with the support to move on. If there is any questions, I'm willing to take a couple of questions. I do have another presentation. It's about the power of the story. La Familia Counseling is creating a training for all people in the community to learn how to share your story, empowering the recovery part of your story. to help heal people, and clinicians to help that as well. So it's a training for everyone. So any questions?
Any other final thoughts too?
Thank you so much. I'm just going to quickly drop my email in the chat because we are really interested to connect with everybody and to build relationships. So for instance, like we love to send folks to Amber House or to Sally's Place, right? Like if and when situations arise. And so we want to make sure that we have like established like contacts everywhere, right? Like to build that network of support in the community. And so we love to connect, and I'm just like appreciative of this space to meet you all, you know. Thank you.
Thank you so much, everyone. Keep up the good work, everyone. Keep up the good work.
Go ahead, Celeste.
I just wanted to add to say that on our mobile crisis team, we will see anyone, regardless of age or regardless of insurance status. A lot of times programs are precluded from helping individuals based on their insurance status. So we don't, we'll see anyone on a crisis team to help mitigate the crisis. And then we can talk about what options and resources individuals have. So that's something that I think the community should.
Thank you, Celeste. I'm showing my screen with our website. Check out our website. I put together a bulletin board so people can continue the conversation. If you ask questions, one of us will get back to you about these services. Cool.
I have to say all our staff are peers. We're all peers. No clinicians are at Sally's Place. We're all peers. Support specialists. So I just wanted to add that part. I forgot to say that.
Awesome. It's so good to see everyone. Everyone take good care, stay healthy, stay well, and we'll see you soon.
Virtual hugs.
Thank you.
Thank you. Thank you all.
Thanks, everyone.
If
Thanks so
the
much.
panelists want to stay on to just check out, I know you're super busy. You're welcome to stay or to move
Don't
on to your
forget
next
to
thing.
smile. It loosens wrinkles.